Welcome to today's episode of HSO Healthy U University, where we team up and collaborate with HealthSource of Ohio clinicians and team members to share information to keep you and your family healthy.
My name is Donna Messinger, and I'm the diabetes educator here at HealthSource. November is Diabetes Awareness Month, so I'd like to share a little bit of information about diabetes and about our intensive diabetes self-management program here at HealthSource. According to the CDC, over 38 million people in the United States have diabetes. That means 1 in 10 individuals in the United States have diabetes. Here at HealthSource, our main goal is to provide resources and tools for patients with diabetes so they can better manage their diabetes and their health. Our intensive diabetes self-management education program will provide these tools and resources that they need. Diabetes is a chronic health problem in which there's too much glucose in the bloodstream. When there's too much glucose in the bloodstream, this can cause serious health problems. It can affect the eyes, the kidneys, the heart, the nerves, and the lower extremities. Again, our goal here at HealthSource is to provide the tools and education that patients need to better manage their diabetes. One way that we manage diabetes is through monitoring. Here at HealthSource, we have a very comprehensive program, and monitoring is one of those areas that we focus on. Patients often come to us not understanding how to check their blood sugar or when they should check their blood sugar or what those numbers should look like. So here at HealthSource, we help patients to navigate that and set goals for them. Each person's individual goals are different. One way that you can monitor your diabetes is through a blood glucose finger stick, and another way is through a continuous glucose monitor. Each patient's goals and frequency of testing may vary. Some patients may need just to test their blood sugar 1 time a day or a few times a week. Other patients may need to test their blood sugar 5 to 6 times a day, depending on the medication and risk factors that are involved. Post-meal readings are something else that we look at, and what their blood sugar is after they eat. Most patients with diabetes, the goal is for their blood sugar to be between 80 and 130 fasting or pre-meal. And then 1 to 2 hours after the start of the meal, it should be 180 or less. And again, those goals can be changed or individualized based off of that patient's risk factors or medication. Other areas that we focus on here at HealthSource with managing the diabetes is healthy eating. We help patients to do meal planning, carb counting, label reading. We go into problem solving, help patients to determine what may be affecting their blood sugar, causing it to go up, what they do if their blood sugar is high, what they would do if their blood sugar drops too low. We go into medications, and we help patients to understand their medications and potential side effects, and to understand why they need those medications and insulin. We go into the benefits of physical activity, and we also will talk about reducing risk and complications related to diabetes. We also help patients with ongoing support and healthy coping skills. If you feel like you would benefit from engaging in our diabetes self-management program, let your clinician know, and they can place a referral to the diabetes program. If you are concerned that you might have diabetes and want to know what the symptoms of diabetes are, the main symptoms for diabetes are increased thirst, increased urination, fatigue, maybe blurred vision or visual disturbances. Sometimes you could have a rapid weight loss if your blood sugars are running really high. So if you're concerned that you might have diabetes, your clinician will more likely do some blood work on you. One of the labs that we do is called a hemoglobin A1C. Hemoglobin A1C tells us what your blood sugar average has been over the last 3 months. If somebody has a hemoglobin A1C between 5.7 and 6.4, that's considered pre-diabetes. If they have an A1C above 6.4, 6.5 or higher, that's a diagnosis of diabetes. And again, we want to identify patients that have pre-diabetes so that we can make those changes or help those patients make those changes so that hopefully it prevents them from developing type 2 diabetes. There are 2 main types of diabetes. There's type 1 and type 2. Type 1 is an autoimmune disease. Something attacks the pancreas. The pancreas can no longer make insulin. Those individuals have to go on insulin to survive. Type 2 diabetes is more of a progressive disease. Normally, type 2 diabetes is family history of diabetes, maybe people that have sedentary lifestyles, maybe overweight. Other risk factors could be women that have had gestational diabetes. Over 90% of all the people that have diabetes have type 2. Only 5% have type 1. The other 5% is a mixture. There is a diabetes that we call type 1.5 or LADA, and then there's also gestational diabetes. Many patients will ask, can I reverse or put diabetes into remission? And it is possible that type 2 diabetes can be put into remission. A lot of times those patients have lost maybe a lot of weight, maybe really changed their lifestyles and eating healthy, exercise. But yes, type 2 diabetes can be put into remission. So generally, type 2 diabetes is generally more older adults, and sometimes, like I said, it's people that have, sedentary lifestyles. But now we are starting to see children with type 2 diabetes. Years ago, we didn't see children with type 2, and mainly that's due to their sedentary lifestyles and unhealthy eating and just basically not being as active as they used to be. Type 1 diabetes used to be called juvenile diabetes because we thought it was mostly children that had type 1. Well, we soon found out that anybody could actually have type 1. It is definitely more prevalent in children and young adults, but anybody can develop type 1 diabetes. I've had a 70-year-old that has developed type 1 diabetes. For additional information about diabetes or our diabetes self-management education program, please visit our website, or you can talk to your clinician at your next visit. Thank you.